Okay, so hello everybody and welcome to this workshop on stress and stress management. So first of all, thank you Thibaut and James for inviting me. It's quite an adventure for me to come here. I've never been in Bratislava before. And in this workshop, the first part is aiming at increasing your understanding on stress and I will present, hello, you're on the video. So I will present some basic knowledge on the stress model, stressors. We will address some stressors and also our stress response systems. And based on this knowledge, we will deduce some stress management approaches which you can personalize after for yourself. So let me first introduce myself. So as you may know, my name is Ariane Orosz. I hold a PhD in neuroscience and an advanced training as an integrative or body-oriented coach, counselor. I'm currently working at the psychiatric hospital. You see the nice view over Lake Zurich. So this hospital is in Zurich in Switzerland. And in detail, I'm working at the Center of Stress-Related Disorders, and I'm working with burnout patients, and I'm doing the group therapy in stress management and also biofeedback treatments, if you know that, and also doing some research together with the Swiss Federal Institute of Technology. So we're currently running a study on stress-related disorders. And last but not least, I'm also a self-employed coach. Okay, so I will talk a lot about burnout patients, so I hope you don't feel addressed by this yourself. Okay, so when patients or clients come to me, their first aim in stress management is they say, I want to become stress resistant, and I want to prevent stress for the rest of my life. So I first have to disappoint them because simply it's not possible, and you don't want that either, because our stress response is our ability to react or easy to and also to manage threatening situations or stressful situations. So this means basically stress is an adaptive response. It helps us to adapt to a range of stimuli, and this adaptation occurs by physical activity. So we need energy for physical activity. So I put them into, that's not brackets, I don't know what this is in English, but I'm sure you have a different concept, definition of energy than I have. So please be a little bit open for a more abstract explanation of energy. So you may have seen this depiction in the context of stress. It's a little bit annoying because everybody brings it, but it conveys two important information about the stress response, namely it is physical activity. So by doing something, by flighting or fighting, you should be able to manage the stressor. And the other one is that the stress response is very old, even older than the Stone Age tiger. So probably it was developed with the first mammals some hundreds of millions of years ago. This means when something is conserved over the evolution for such a long time, it increases our probability to survive. And it also means that we have become real stress experts. So we are pros in having stress. Okay, stress is not always as simple as running away from a tiger. So but it's a very complex mechanism, the stress response. I will guide you through this stress model. It's the most common stress model by this famous stress researcher Bruce McEwen. And here on the first level, it's the stressor. It's a stressful situation. Stimuli, just a few examples here, the daily hassles, so the things you have to deal with every day, and also specific stressors from work, family, your personal life, also physical stresses like the heat at the moment here, and it is also a strong stressor for our body. And there's a specific category of stresses. These are the major life events. We will have a look at them in a minute. And how you perceive these stressors is strongly influenced by your individual condition, which is also a very large and rich bouquet of a lot of things, like your genetic information, also epigenetic factors. These are the influences from the environment which influence which genes are expressed and which are not expressed. Of course, your development, your experiences you've made in your life, and also your current stress level. You react differently to stimuli if you're relaxed or in a stressed out state. And the stressor and the perception of the stressor and also your individual condition strongly influence your behavior response. So what strategies do you apply to get rid of the stressor? Are you flighting or fighting? And there is also a range of stress promoting behavior like sleeping less, working more, treat yourself with various substances. And there's also stress reducing behavior like eating healthy, discussing with your friends, talking about your problems, sleeping more in order to get enough energy, and so on. And all these factors together, they result in a physical response, stress response, which aims at adapting you to the stressor, to the stressful situation. And of course, if you engage these mechanisms in a permanent way, the adaptation doesn't work anymore, and it results in exhaustion or overload. I've seen that you're taking a picture, so you can have the handouts.
Oh, good.
So just write James and you get the slide.
I'll send it out to everyone anyway.
So just forgot it. And also forgot to say, if you have questions, please save them for the end, because with my experience is that most of the questions are answered later on. But if you have a specific question, don't just ask me. Okay, so let's have a closer look on the stressors. I picked stressors especially in the context of work, and this is the result of studies of organizational psychology and also from burnout research. These are the top 10. I only pick a few. So, for example, it's rarely the workload, simply the workload which leads to exhaustion or stress-related disorders. It's mostly more these other aspects of work. So one of the main stresses is the lack of communication or transparency. So you don't have the information you need to feel well in a company or a team. What is also a big stressor, I don't know how it is in your country, but in Switzerland, especially in academic jobs, it's a trend to have 1-year contracts. So you cannot plan on the long term because your job is not secure for more than a year. A very strong stressor. What is also strong stressor is, little appreciation, little recognition of your work by your team, your colleagues, your boss, and of course reflected in a too low salary. It's also a lack of appreciation. And there's the main stressor. I haven't written it here, so I just want to ask you, what do you think is the main stressor for everybody at work? What has the largest impact on your well-being at your job?
The first one, high pressure.
No, there's something lacking. Okay, high pressure is also an important one, but the main stressor, I haven't put it here. Not yet. Colleagues, yeah, almost.
Myself.
Frequency, lack of communication normally.
This is here already. But yes, it's one of the main stressors. Okay, I don't.
Not clear. What?
No, one is lacking. I haven't
Yeah.
put it here. Okay.
Not having clear.
Objectives. Yeah. Okay, I believe you. Your boss.
Yeah.
Your direct supervisor, your direct manager, he or she has the largest impact on your well-being in your work. So think of that. So especially if you are a boss already or a supervisor, think about that. Okay, so I was mentioning the major life events, or also there's also called the critical life events. I hope you see this list. So this is a list of stressors which cause stress in human lives. So just have a look for a minute. Maybe this list seems strange for you.
I would change that. I would put divorce, the first one.
It's also a loss.
Yes, it's better
Or a
death than divorce.
maybe a loss.
Yeah.
Or maybe a deliberation. Okay. Yes.
But this is quite old, the list. It's from 67.
Thank you. When I show this to patients, nobody notices the the year. Okay, so I tell you this is still valid. It has been reproduced, this list, the exact list, in 2001. And these are large changes in your lives, in human lives, and they seem to be very stable. So these are events which you, this is a good example that stress is an adaptive response, needing energy for adaptation. So I picked some which don't have to be negative, so marriage or having a baby, or easy, also personal achievement, change in residence. This could be good things, positive things, yeah.
Yeah. Is it written for a man? Because it says, for example, wife became.
It's an old study. So maybe the newer one is written partner. Yeah, exactly. So it is a funny list, but still valid, maybe with some adjustments. But it shows perfectly that these are large changes which you have to adapt to. So stress is not always negative, but these are changes and events which need a lot of energy to adapt. And so think about stress as adaptive response which needs energy. And of course, if you have several events at once, you have more stress. So.
Cumulative.
What does martial separation and reconciliation mean? Going to war and coming back?
Which one?
Martial separation, and the third one is the nine.
Nine. Oh, Marshall.
Yeah. Is it going to war and coming back from war?
Yeah, reconciliation is like kind of making up.
But it's not marital, it's martial.
Marshall.
Oh, Marshall.
From justice, you make agreement.
Korea
Yeah.
or to
Agreement,
Vietnam.
Yeah.
Yeah, it's Vietnam War, so.
It's related to the rights, the law. When you make agreement with the opposite, you have a kind of discussion. You have a partnership, and you have to make an agreement. I think is this.
Yeah. Yes, I remember slightly the German version, but it's what you said. Okay. Thank you.
Welcome.
Okay, so major life events. So just one patient I had recently, she, in the same year, she left her country, so she's from Germany, got married and also changed job. So she was quite surprised why she has an exhaustion disorder. I think, yeah, okay, you should have known that. Okay, so concerning our processing or appraisal of stressors on the personal level, I also show you some top factors from burnout research. So they are factors on the personal level which influence strongly how you deal with stress. And these are the stress-promoting personal traits. And I just pick the top traits which are very dominant or predominant in burnout patients. And this is the top, the perfectionism. So want to be perfect, want to do everything perfectly. So this is really a strong, let's say, risk factor. Also the inability to say no. So the persons cannot distance themselves from work, from persons, from problems. So also a ticket to burnout. And the other one is problems with self-esteem. So if you think you're never good enough and you could always do better, yeah, this is also a strong one. And there are people who really don't know how to relax. So the lack of resources, so they don't know what to do and don't have any idea how to relax. But this one, after this workshop, you have a lot of ideas. This is my goal objective. Okay, so based on these levels or dimensions of stress response, we can deduce approaches or levels of approach levels of stress management. On the stressor level, there's a citation, I think, of Henry Ford, change it, love it, or leave it. And this is very true for stress management on the stressor level. So sometimes you can change a stressor. So I heard about bosses or supervisors who are open to criticism. I haven't done this experience myself, but it should exist. So sometimes it's worth a try to address a problem, to discuss a problem with your supervisor and induce a change. And sometimes it's the healthiest or the best solution to just leave the problem. So just leave the job or the team. Sometimes it's the best. So don't be too perfectionistic about it. On the personal level, you can do a lot. So, for example, change your perception or your appraisal of a stressor. You can do some reflection work, so about your behavior patterns. So sometimes it's worth going to a psychologist, a psychotherapist, or a coach. Or there are also books or some guides like mindfulness-based stress reduction, which are really helpful to develop some competences on the personal level. These two levels, of course, we cannot address in this group here because they're very personal and also individual. But what we will see later on is on the physiological, so on the body level, where there are also a lot of interventions and possibilities to change your stress response. Okay, so in order to implement what we have learned until now, I give you some minutes for reflection work. So just to have an idea, so don't get deep into the stuff. It's also, I've written it, it's homework for you to try this at home. This is already a stress management tool aimed to characterize the stressful situation, your stressor, and also to do some reflection work. This is a very simple and effective stress management tool, because as soon as you really describe the stressful situation, you already get a distance from it, and it's a little bit of relief. So just think about these questions. So think about a stressful situation you experience at the moment. So is this, you can characterize the stressor. Is it something related to work, or is it something from your personal life, or maybe a combination of both? Is it a single situation, or is it something that you experience again and again? Maybe it's a pattern. Or is it a long-term stressor, which you've been experiencing for a long period of time already? And what exactly is causing the stress? Now, if you think, yeah, my boss, so this is not precisely enough. So think about what behavior or what sentence really stressed you out from your boss. So characterize the stressor as precisely as possible. And then do some reflection work. So if you think about the stressful situation, what is your inner dialogue? So what comments you have in your head? Is this, are you criticizing yourself? Oh, I always do that. Blah, blah, blah. Or is it, oh, this idiot of my boss, blah, blah, blah. So depreciation of your colleagues, maybe. So what is your inner dialogue? And also what emotions do you have in connection to this situation? Is it fear? Is it anger? Or you feel immobilized, hopeless? So really feel what you feel. And yeah, how do you behave in this situation? Are you become quiet? Do you socially withdraw? Are you medicating yourself with various substances? Yeah. So what is your coping strategy? And very important is also to identify your physical, your body sensations. So if you think about a stressful situation, what do you feel in your body? So it's often like a contraction or a stomach ache or tension like this. This is very popular to be connected to a stressful situation. And I told you already, this is a very effective stress management tool. And maybe you already have noticed that as soon as you're thinking about stress, you immediately have emotions and also a body, a physical response. And also if you have an emotion first, you automatically have an inner dialogue and also body sensations. And if you have body symptoms like a illness or something, you also have emotions and thoughts concerning that illness. So I emphasize this because it's important to be aware that these processing dimensions of mind, emotions, and body, they are strongly interconnected. And if you influence one of these dimensions, it has direct influence on the others. So this is important to keep in mind, because if you do some relaxation exercises for your body, it has also effects on your mind and your emotions. So it's not waste of time if you get a massage, for example. Okay, so I was talking about adaptation through energy mobilization. So we will look at our stress response systems, which aim at mobilizing energy in our body. So where does this energy come from? So as soon as the, let's say, non-thinking brain perceives something as a threat or a stressor, two parallel stress response systems are triggered. One is the pathway through the autonomic nervous system, and the other one is the hormonal stress axis. You may have heard already about the HPA axis. This refers to the steps of this hormonal cascade. H is the hypothalamus, P is the pituitary gland, and A is the adrenal glands, where the stress hormone cortisol is released. So these two stress response systems, they really complement each other. So through the autonomic nervous system, you are able to react immediately. So it's very fast. It's neuronal signal transmission. It's very fast, but the stress hormone, the associated stress hormone adrenaline, it's only for a short time in your bloodstream. So if you stop the stressor, it's eliminated from the blood within 5 minutes, like this. And that's why we have the hormonal stress axis. It's quite delayed, so it involves various hormonal sub-steps. So you have various hormones, and the last one is traveling through the bloodstream until it reaches the adrenal gland. So it takes about, if you have a standardized stressor, the peak level of cortisol is measured after 20 to 30 minutes. So it's a little bit delayed, but it stays in your bloodstream for a longer period of time, like 90 minutes.
Which substance?
We will come to that later. It's the stress hormone cortisol.
what are their effects?
We will see.
Okay.
I will talk a lot about it
Okay.
because it's very important for our physical health. Okay, but first we go to the autonomic nervous system. It's typically, oh, you may know it as vegetative nervous system. Sorry. And basically, the autonomic nervous system regulates our vital functions. So all these autonomic adjustments from our organ functions, which we normally don't have to think about. So maybe you, for example, you don't have to think about increasing your heart rate when you're climbing a stair. You don't have to think about switching on your digestion after your meal. So all these things that normally just work. And the autonomic nervous system is typically divided into two subdivisions, two parts. And these are the sympathetic and the parasympathetic nervous system. The sympathetic nervous system is responsible for energy mobilization. It's the main actor in the stress response. And it's also compared to the accelerator pedal of a car. So it really mobilizes and activates our body. And of course, its slogan is flight or fight. And its counterpart is the parasympathetic nervous system. And this one is responsible for regeneration, from building up resources, recovery, and it is compared to the brake pedal. And its slogans are rest and digest, or also feed and breed. Yeah, sometimes the autonomic nervous system is a little bit too abstract, so that's why I brought you an anatomical picture. So this is the spinal cord without the vertebral bodies. And you see this pearl chain-like structure here. It's located towards the belly, so it's outside of the vertebral column. We have this paired pearl chain-like structure, which is called the sympathetic trunk. And these pearls, I know it's too far away, but these pearls are the ganglia, so the cell bodies of the sympathetic nervous system. And from these cell bodies, the fibers go to the target organs, to every organ. The parasympathetic nervous system is organized in two centers, one in the lower part of the brainstem and in the sacral spinal cord. And from the brainstem, these fibers are going to the upper organs, so like until the middle of the intestines. And from the lower part, the fibers go to the lower organs. And I already would like to prime you on a term. This is the vagus nerve, the nervus vagus nerve. We will talk about him or her, it later on, because it's very important for stress management. Just keep in mind that word. Okay, so there are a lot of important things to know about the stress and the autonomic nervous system. So one is that almost every organ is innervated by both divisions, which makes sense. Think about adaptation. So through the accelerator and brake pedal, they can adjust the organ function to the situation by activation and deactivation. So almost every organ is innervated by both divisions, and it's always both divisions are active. So it's not during stress response only the sympathetic nervous system is active, and during relaxation only the parasympathetic nervous system. So both are always active, and depending on the situation, one is more dominant than the other one. And based on the functioning of the organs, we can monitor the influence of the autonomic nervous system. And one organ where you can feel it or monitor it very well is your heart rate. Before I'm explaining more, I invite you for a little experiment. So feel your pulse. So like at the wrist or here at the carotis. So it's not about counting like we are used to do it, but feeling, observing. So, my favorite question, who has a regular pulse? Regular pulse, regular heart rate. Who?
What counts as regular? What counts as regular?
Yes.
Not just
The same period.
yeah.
Oh, right.
Yeah, sure.
Yeah.
So who has a regular pulse? What is the right word, correct word for
Periodic.
frequently?
Yeah, regular, yeah.
Regular.
Yeah, I just didn't know what that meant.
Okay. So who has a regular pulse? I don't think so. Okay. That's why it is my favorite question, because oh yes, of course. No, okay. So try it another time and breathe slowly, and then I will ask you again.
Not easy.
You know the solution. Okay, who has a regular pulse? Ah, perfect. So, somebody who hasn't a regular pulse, what have you observed?
During the in-breath, it's a kind of periodic frequency. When you
Yeah,
those change the
exactly.
rhythm
Okay. Okay, so
in and out.
yes, exactly. So what you hopefully have observed is your heart rate variability, the HRV. And basically, the heart rate variability is the spontaneous change in heart rate from beat to beat. So if you look at the schematic ECG here below, you see that the interbeat intervals are always different. So it changes in the range of milliseconds. And this is a good example for adjustment of the heart rate by sympathetic and parasympathetic nervous systems, really a beat-to-beat adjustment. And the sympathetic influence is, of course, shortening the interbeat intervals, so increasing the heart rate, and it's also more regular. So it's like so think about what you need when you're flighting or fighting. You need a regular, fast pulse. And in contrast, the parasympathetic influence is, of course, so increasing the interbeat intervals, and it also makes the heart rate a little bit more variable. And now, as you were at rest in a seated position, then a very specific form of heart rate variability is experienced. You can forget that name, but it's called respiratory sinus or sinus arrhythmia. And this is the heart rate variability connected to respiration. So it is what you have experienced or observed. So when you inhale, the heart rate goes up, so increases, and during exhalation, the heart rate decreases. And this effect, so at rest, is controlled predominantly by the parasympathetic nervous system. So at rest, the larger or the higher your HRV is, the stronger is your parasympathetic influence. So this amplitude, so the difference in heart rate during exhalation and inhalation, is an index for regulation capacities, the force of your parasympathetic nervous system. So the more HRV you have, the more regulated you are, the healthier you are. That's why the heart rate variability is called the window to the ANS. So the good news is that we can train our heart rate variability, and this is by paced breathing. And you have to know that it's a natural phenomenon if you're completely relaxed and also during sleep. This heart rate variability and respiration cycles, they start to synchronize. This is a sign of relaxation, and we can also induce that effect because this synchronization of these two curves occurs all over the world. So everybody, almost everybody, at the respiration rate of 6 breaths per minute. So you can see it here in this measurement here. This person has quite a good heart rate variability here. And yeah, okay, breathing was a little bit chaotic. But here, he or she started to apply this paced breathing. And then you see that it immediately synchronizes and heart rate variability increases really immensely. So this is the second stress management tool you can take home after this reflection work. You can apply paced breathing in order to get increased heart rate variability. And this 6 breaths per minute, this means per respiration cycle, you need 10 seconds. And these 10 seconds are not equally divided because you have experienced that during exhalation, the parasympathetic nervous system is active. So the exhalation is prolonged. And this is the paced breathing, 4 seconds inhalation, 6 seconds exhalation. We will try this out in a second. So you can observe the effect. If you would like to train that, here are some apps I can recommend for iPhone and also Android phones. These are free apps and they are just pacing your breath. So you can customize the timer or the pacer and you can breathe with that very easily. I've done that before the presentation.
Interesting, because in yoga you have kind of breathing. You have 4 per 4, 4 per
square, yeah.
4, 6, 8.
Yeah.
So
this is a good input because this is not the only breathing pattern to relax. This is the specific breathing pattern to increase HRV. So, but there are a lot of other methods to activate your parasympathetic nervous system and to get relaxed.
So now I understand. You meaning that when you change the time period of the inhalation 4, 6, you are changing the sympathetic and parasympathetic impulses. How they are talking each other.
So with breathing, we will look at it later. But with breathing exercises, you can activate your parasympathetic nervous system anyways.
I mean, if you, for example, I use a kind of breathing period, I can rise more sympathetically and then rise
if you
more.
Emphasize the inhalation, you can activate yourself. Okay. Yeah. So if you want, if you're
change this.
Yeah. So if you are really dizzy or close to falling asleep, you can activate yourself, your sympathetic nervous system, like really activate yourself. But I don't think that you need that. You need the opposite to calm down. Okay. So use these apps. You have them in the handout. And why we should do that? So why we should activate our parasympathetic nervous system? I told you in the beginning that we are stress experts. And this is true as long as we have periods of recovery between the stressors. So if we oscillate between activation, deactivation, between stress and recovery periods, if we really balance the sympathetic and parasympathetic activation, we are perfectly fine. So we stay healthy. But if the emphasis is too strongly on the activation, on stress, on the sympathetic activation. This balance is disturbed, and the result is like an exaggerated sympathetic activity. So it is just, there are just a few examples. So persistent stress leads to a sympathetic dominance, and also because they are antagonists, sympathetic and parasympathetic nervous system. So if you activate your sympathetic nervous system for a too long period of time, the parasympathetic fibers, they withdraw. So you really have less innovation. And this you feel especially in connection to digestion, that sometimes you have problems because the parasympathetic nervous system says, okay, I don't have to work, so I withdraw myself. And also typical muscle tension. This is a normal sympathetic reaction. And if you have persistent muscle tensions, you get pain. So the very typical stress symptom is lower back pain. This one is your stress response, knocking. Also sweating. You change your breathing patterns. Your blood pressure is increasing. Your heart rate is chronically increasing. HRV is reduced. So there's a long, long list of symptoms. So I found a very good citation in a newspaper. So what we mean today when we talk about stress is, I miss my parasympathetic nervous system. Okay. So that's why we want to activate our parasympathetic nervous system now. So please start the video. This is a breath pacer. So take a few minutes, about 3 minutes, and just breathe with the balloon. Exhale when it's down. Inhale. So maybe you have felt something. So I recommend to do this paced breathing for at least 3 minutes. So it takes some time until your body really get used to that respiration pattern, and then you will feel this. If you practice that, my experience is that you feel this coupling of breath and respiration and change in heart rate. So really feel this, okay, now I'm in the flow. So it's recommended to do paced breathing for at least 10 minutes a day. So 5 minutes in the morning, 5 before going to sleep. You can try that for 3 weeks. Maybe you feel a sustainable reaction. And yep.
Is it normal to feel busy?
Oh,
No?
I know.
I started feeling a bit busy.
Yeah, me too.
Yes, you're not used to that. So in a second, so it's about breathing technique if you get dizzy. So as soon as we are talking about diaphragm, you are addressed. So not only you, but it's a good question, because we are, if you are not used to breathe deeply, then yes, you activate your sympathetic nerves and you have too much oxygen in your blood. Okay. But it's okay. Otherwise, extend the exhalation, then you're fine. Yes, paced breathing, very easy and good stress management tool. If you really want to train your HRV, it is recommended to breathe like that for 20 minutes. So this is hard work. Okay, so we have the other stress response system. This is the cortisol, so the hormonal stress axis. And cortisol is, yes, the most prominent stress hormone. And you maybe know it as a drug. So it's the same as cortisone. So cortisone is the inactivated form that you need, that you use for medication. And cortisol is the active agent in your body. So cortisone you may know as a cream if you have skin issues, or as an injection in joints if you have some inflammation, or if you have asthma, it's also used cortisol. Cortisol is our stress hormone, one of the most important stress hormone. And think about stress is energy release. So the main role of cortisol is to deliver energy. So it releases sugar into the bloodstream from the liver, from storages. So energy activation. And the other important role of cortisol is immune system suppression. So it's anti-inflammatory. So that is the role for what it is needed in medication. It's medication. And it has a very bad reputation, cortisol, because it has a lot of side effects, so adverse side effects. But you have to know that it is a vital hormone. So without cortisol, you would die. So we have it always in your blood. And it follows a diurnal rhythm. So you have the highest concentration in your blood in the morning. So it's the cortisol awakening response. And then during the day, the release is decreased. And before going to bed, you have hopefully the lowest level. And this is kind of the background program. So this diurnal rhythm, it just works. And if you need more energy because you are in a stressful situation, additional cortisol is released. And yes, remember your last deadline or exam. So for a certain period of time, like some weeks or a month, you have a lot of energy. You're really high performing. In this period of time, you don't get sick or ill. It happens after the deadline in your holidays. So this is typical, because when the cortisol level is decreasing, all these viruses and bacteria, they celebrating a party. Yes, and also cortisol is also helps you to have a higher cognitive performance. So your brain is very active and it works very well. So cortisol is a good thing for a limited period of time. And the same as with the sympathetic nervous system, if you engage it for too long period, it turns against you. So if you see here the typical curve, so the blue one is as it should be. And if you, due to permanent stress, you always release additional cortisol, the overall level is increased. You see it here. And one effect is that during night, you have the same level of cortisol as normally during daytime. And that one is very obvious in sleep problems. So I'm sure you know that myself. If you wake up around 2 hours before your alarm clock, like this is your cortisol level. It really kicks you out of bed. And what also happens is that this immune system turns to the opposite, and you get very susceptible for infection diseases. And what is, as a burnout patients really suffer from, is that loss of cognitive performance. So they have a lot of problems with memory, especially short-term memory, and they are thinking that they are going mad now. So they are suffering from that very much. But the good news here, I already said, tell you, it is reversible and quite fastly. So the patients are at our unit for 6 weeks, and after 6 weeks, they already feel better. So, but you have to reduce your cortisol level. Otherwise, it will stay like that. Okay, so of course, if you permanently increase your blood sugar, your risk for metabolic diseases increases, like diabetes, weight gain. If you tend to gain weight when you are stressed, there is also the opposite phenomenon. The fat is typically collected around the belly. This is this famous apple shape, which is a risk factor for cardiovascular diseases. Okay, so in sum, through the autonomic nervous system and the cortisol system, almost every body function is affected by stress. So it is sometimes, this may be because of stress, and then you say blah, blah, blah. But it's true, because every body function is influenced by these, by autonomic and also cortisol influences. So watch out for your personal warning signs, because they are. So burnout patients often report, so yes, I had this issue, I just ignored it. So be aware of your personal warning signs and take them seriously. I won't go into details, but in your handouts you will have there are some typical stress-related disorders if you permanently ignore your body signs. Okay, so now it's time to get to know our anti-stress systems. So based on the knowledge we have now about our stress response systems, we learn about the anti-stress system. It's not an official term, I just call them like this. And it's quite a simple approach, so you just have to activate the opposite, the antagonists of our stress response systems. And in terms of the autonomic nervous system, we have learned that the sympathetic nervous system is responsible for stress. So it's quite logical. For relaxation, you have to activate your parasympathetic nervous system. And this is quite easy. So here it is, the nervus vagus. You have heard the term in the beginning. And the nervus vagus is the largest and also the main nerve of the parasympathetic nervous system. And this is a antique depiction of the nervus vagus. It's not too correct, I think, but important to know about that this nerve is huge, so you have it almost everywhere in your body. Here, for example, so in the intestine, so this makes sense because parasympathetic nervous system is responsible for digestion. But what is more interesting to us now is this upper branches, like in the face, throat, larynx, this is heart, lungs, and this one is very important, the diaphragm. This for you. And the first approach to activate our parasympathetic nervous system we have already seen or experienced. So by breathing, you can access or activate your vagus very easily. This one we know by paced breathing, so extend the exhalation. Very easy. And what is also very important is the technique, so that you use your diaphragm here. This is the muscle between the belly and the chest part. So it's in the lower part of the rib cage. It's like a parachute in the middle of your body. And this one contracts when you inhale and releases when you exhale. And when you experience chronic stress, you automatically lose the ability to breathe with the diaphragm. Is this a?
I don't know what this is actually.
Someone is destroying the building.
No.
Ah, okay.
The large.
Is this a stressor? Okay. So one trick to engage your diaphragm, because it's quite difficult to engage your diaphragm if you have forgotten how to do that. Normally, if you're in a normal state, balanced state, you breathe with the chest muscles and the diaphragm equally, or 60% here, 40% here. And if you experience chronic stress, so it's rising up, and you are like numb. And one trick to engage your diaphragm is exhaling against resistance. And I brought you a very effective stress management tool. These are straws. So I don't know if you just want to take one and give it further. So we will try that.
It's great to do it again.
You know already everything here.
Okay.
Just pick your favorite color. You can keep it.
Oh,
One back.
Sure.
Swiss straws.
That's pretty.
Sorry.
You can take several one.
Imagine this is.
No. No, it's not about inhaling, it's about exhaling.
Cigarette increases heart rate.
Yeah, right.
Not-
Time management.
That's the process you see.
Yeah, it's okay.
Along my arm hurt. Yeah, you should have done. Wait.
Orange snorkeling.
Hmm?
Orange snorkeling.
Snorkeling.
You're very funny.
Okay, so now we do a little experiment. So when I tell you go, you just count your breath until I say stop without a straw.
Wait,
And
Hold.
how many breaths you mean? How many breaths?
Both?
okay, I say go,
Yeah.
and you just breathe and count your cycles.
Number.
So one
Okay.
inhalation and exhalation are one.
Okay.
And you count it until I say stop.
Mhm.
And I just explained the experiment already now. And then after this first part, you take the straw, and then you inhale and exhale through the straw. You don't have to count. You just make this, do that until I say stop, and then I say go, and you count your breath again. Okay? So just breathe normally now, without the straw, but keep it in your hands. And just where's the timer? Okay, so ready? Just breathe. Just breathe and count your cycles. Okay, go. Don't speak, breathe. And stop. So write the number you have counted. Or keep it in mind. Okay, so now take your straw. And when I say go, you breathe in normally, so don't inhale through the straw. It's getting a little bit stressful. So inhale normally and exhale through the straw. Okay, start. Okay, so stop. And again, breathe normally and count your breath. Go. And stop. So the number now should be a little bit lower. Okay, it always works. So this is dizziness. What about dizziness? Yeah. Okay, so this is your instrument. So exhaling against resistance. Oh, what happened to the... Thank you.
No stress.
No, I have my strength.
Uh,
Yeah. Also stress management. Kill the boss. Okay. Okay, so breathing, very good and easy way to activate your vagus nerve. Exhaling against resistance. If you don't have a straw at hand, you can also apply another trick. It is like, I call it the cooling of a soup or a tea. Like, you can do it also in a meeting. So like, this is this movement with the lips. Cooling of a soup or a cup of tea without a straw. Okay, there are other approaches or possibilities to activate your vagus. And one of the preferences of the vagus nerve is low frequency tones. So it likes low frequency tones. So everything. Scheiße.
no stress.
You understand German?
Yeah.
Certainly that word anyway. Okay, sorry. Yes, swearing is also stress management.
You blast.
You?
You blast. You blast.
Ah, okay. Sympathetic nervous system. It's okay. I need it. No, it's because of the heat. No, just have you seen on Netflix? There's a documentation, The History of Swear Words. Watch that, because there's also stress. They measure pain resistance, and if somebody swears, you can, you're more tolerate more pain if you swear. So it helps as well, but it's not on my slides. Okay, so we were at the low frequency tone, so music and singing with exclamation marks. This is really the cure for everything. So singing helps a lot to relax, to manage your stress, and also chanting. So I
Mantras. What is
mantras, yes. I really discovered this. Going to sing some mantras. Yeah. Yes, this is really a very good way to recover, to release stress. Also humming, gargling, bubbling. You can use your straw and blow into your water bottle. This one relaxes your pharynx. So this is also vagus nerve activation. And of course, there's a huge list of various, interventions or practices you can activate your vagus. Yoga is very well, there's a lot of research about the effects of yoga, very strong activator of the vagus. Mindfulness practice, so if you have, there are various tracks on Spotify, for example, also on YouTube. It's mindfulness-based stress reduction, very strong, very effective. Maybe you know progressive muscle relaxation. Also, you can find it on YouTube. It's like tension and release. It's the release that you really helps you to release. And also rhythmic movement. So there's one very good method to relax yourself, like clapping and moving and don't do that in a presentation, but at home maybe. Okay. And there's a rule of thumb. I think that you can keep it in mind like this in a better way. Everything that reminds you of tribal rituals, like singing, dancing, making music, praying, meditating in company. This is all vagus activating. So tribal rituals. Okay, so in connection to parasympathetic activation, or to vagus activation, I would like to show you some recordings of long-term HRV. So these are 24-hour measurements of heart rate variability. And this was in I did these measurements with burnout patients for a study. And so they wear the little ECG device for 24 hours. And they had to report their activities. So I will guide you through. You don't have to read it. This is in German. So what you need to know is this is the time axis. So you have the 24 hours. And this is these are frequency bands. And everything about this, above this line, in this high frequency area, everywhere where there's color, it indicates parasympathetic activity. And yes, you first notice this block here of very strong parasympathetic activation. This, of course, is sleep. This patient slept very well with strong parasympathetic or vagus activation here. This you even see the sleep stages. This is deep sleep. And during the day, we identified various islands of parasympathetic activation. So first of all, lying on the terrace, sunbathing on the terrace, shiatsu, this is kind of an energetic massage, watching TV and sauna. So we found out that this patient is a very passive one. And so he relaxed or she relaxed it when doing nothing. So lying around, watching TV and passive relaxation. And I named this slide to each his or her own. So when we look at this, I have another one. So relaxation is really, so if you, for example, I told you that yoga is good for parasympathetic activation. If you hate yoga, it won't work. So really, try out things and pick the activities which you really like. So it's not same size fits all. Okay, so this is the other patient. Again, you see here the sleeping period. Also a good sleeper. It's not typical for burnout, but okay. You may have noticed that during the day, this patient had less parasympathetic activation. So it's more stressed out during the day. And we identified these islands of parasympathetic activity. It was quite clear when he relaxed, watching TV, and mindfulness-based stress reduction. So we summarized that it's distraction and directing attention. It was its method to relax. And there was also a fun fact. Here, it's dinner with partner. So it was not true. So it's also a diagnosis of other things here. And this guy, yoga was not too relaxing for him or her. Okay, so pick your own relaxation technique. Okay, so activating parasympathetic nervous system. So now you have some approaches. And with regard to cortisol, so an increased cortisol level, it's very obvious, reduce your cortisol level. And this is easier than you think, because just use the cortisol for what it is released for. So we have seen cortisol is for the long-term stress response. So it's for long fighting and flighting. So the best way to reduce your cortisol level is by endurance sports. So hiking and not hiking, biking, running, swimming. So everything that is for a longer time. Recommended is at least 3 times a week for 20 minutes. Don't panic. It's not the pushing your limits. It's in the range of 70 to 80% of your maximum heart rate. And normally it's in the range of a pulse or a heart rate of 120, 130. And you have this very quickly. So it's not. So you should be able to talk during your sports. So not during swimming, it's difficult, but when you're going for a run, the best is you're going with a friend or a colleague, and you should be able to talk. And the ETH, so the Swiss Federal Institute, developed this talk test. This is very valid. So you should be able to speak a sentence with 5 words and 5 consecutive words. So you should be able to speak almost normally. And yes, what is really typical for performance-oriented people is, okay, I do some high-intensity sports, then I will reduce my cortisol level even more. This is not true, because as soon as you're pushing your limits, this is a strong stressor for your body. And what is your body doing when it has stress? It produces more cortisol. So you can do some intense sports for your hobby, but it's not the same as stress management. So you have to differentiate between stress, so cortisol level reduction, and hobby sports or high intensity sports. Both is okay. So it's not, one is not better than the other. They are just 2 different pair of shoes. Don't forget that. So if you know Nordic walking, this is the best exercise to release cortisol level. So it's not only for older people. Okay, so if you really hate sports, there are other possibilities to lower your cortisol level. Just check the time. Okay, I have to hurry. Okay.
Did you mention Nordic walking?
This with the sticks, with the walking sticks, so fast walking. Okay, other possibilities to use your cortisol is just a small list here: dancing, music therapy, or listening or making some music, yoga again. There's also a special form of yoga, laughter yoga. So just for it on YouTube, there's very funny stuff there. Again, mindfulness meditation. So you may have noticed very similar approaches as in techniques as in for vagus activation. And this makes sense because it's also the similar stressors that trigger our stress response system. So it's also the opposite. So the same things trigger or activate cortisol reduction and parasympathetic nervous system. Yeah, what is also very helpful to lower your cortisol level are massage, and especially by a significant other. We will look at the solution, or why is it so, in a second. Because another possibility to reduce your cortisol level is to release the antagonist. And this is also one antagonist. And this is the hormone oxytocin. You may have heard about this. This is our cuddle or love hormone or bonding hormone. So it has a lot of names. Actually, it was discovered in the connection of gynecology, because mothers during giving birth and during breastfeeding, they just release oxytocin in large amounts, also the baby. And the effect of oxytocin is to reducing anxiety, and also induce or promote the feeling of calm and safety, and also promote well-being. And it is also associated with more complex feelings like empathy or love, and and so on. Also released during sexual activity. And you may now think, so a very frequent question is now from the performance-oriented burnout patients, yeah, where can I buy this? You can buy it. Oh, sorry, here. Oh, shit. Maybe I'm too relaxed now. So you can buy it. Oh, I forgot the direct anti-stress effect. So it decreases our cortisol levels. We have seen that. And it also activates the parasympathetic nervous system. So we want that. And you can buy it. I've seen it, I think, in England. Or, you can buy it also online with very great promises like restoring love and happiness or liquid trust. And yes, and a little anecdote here. I wanted to try that.
You should try this.
Yeah, I just wanted to tell my own experience. So, yes, of course, I wanted to try it. So I have to try everything I tell you. And it is, you can buy it in Switzerland, but only as a medical doctor. And I asked a friend who's a medical doctor to buy a little bottle of oxytocin for me. And then I got this in the pharmacy. And then I tried it. And then I haven't felt anything. And then I started to read the patient information. And then it was so clear because it's a drug used in gynecology. So it promotes uterus contractions and enables the milk production. So I stopped using it. So I maybe better to produce my own. It's also better for you, produce your own oxytocin. So now I will give another try, but not just, it should cause a short relief, a short, I would say, a short period of feeling well, because it's also used in specific forms of psychotherapy of specific phobias. So if somebody has is afraid of going to large crowds of people, you can make use the oxytocin just to induce a feeling of well-being and in a situation which normally causes stress and anxiety. So it may help. It's not too popular, maybe because of the side effects. Okay, so produce your own oxytocin. It's quite easy. So think about love hormone, bonding hormone, cuddle hormone. So interpersonal touch, so sexual and non-sexual. So hugging, cuddling, and also massage. And of course, you can cuddle with your pet. It's also very helpful, very effective. So, cats here. And also without touch, positive and friendly interaction. Positive environment. So if you have a happy place, so it's no waste of time to go there. Also to think about, so really go mentally to that place. It's also helpful. Yeah, pleasant stimuli. So scents, texture. So if you have a favorite blanket to cuddle, also helps. Singing again, cure for everything. Also chewing, eating. It is because you have some receptors in your mouth, so mechanic receptors, and if they are activated, it releases oxytocin. So chewing gum may help. Again, mindfulness meditation, and also nice thoughts. So if you have you have experienced a very nice travel, so just thinking about this releases oxytocin. So this, I also give you a rule of thumb. It's a little bit strange, but it's everything that makes you feel safe, like floating in the water, in the uterus. It's releasing oxytocin, so cozy, safe, everything like this. Helps you to release oxytocin. Okay, maybe I did give this for you as homework because I see we're running out of time. Oh, already happened. So homework, I will control that. So it's just about maybe a few words. So I'm sure you already do something to activate your anti-stress systems. And like this, you can make it more mindfully. So you can extend the things you already do. And if you would like to change something, so don't intend to change your whole life from now on, just make little, just define little goals like, okay, I will do my paced breathing for 3 minutes every day. Or I will try it for 3 weeks or 4 weeks, and then I decide if I will keep it or not. So small goals, small changes. Okay, this is my, yeah, let's do that to be the last slide, because there are, okay, now you have some ideas how you can, which techniques you use for recovery. And there are also some tips and tricks regarding recovery. It needs repetition and training. So if you try the paced breathing today and it doesn't help, try it once more. It really needs some, it is called the conditioned relaxation response. So you really need some experience with a specific technique. So try it several times and you can decide after 21 days. I think this is the rule. 21 days, you can decide if it helps or not and try something else. So you need to do it several times and on a regular basis. So don't, okay, I have no time this month, so at the end of the month, I will breathe for 4 hours. This doesn't work. Do it regularly, so every second day, every third day, rather a short time, but regularly. So this is more important. And yes, this is important. So don't listen to the mindfulness-based stress reduction track during work. So really, or what is, yeah, it's no joke, but I have patients, they try to relax through breathing during running. So don't mix things up. Spare time, 5 minutes, but do it really. Yeah, recovery is yours. So this is about, think about these measurements of the HRV, really find out what is good for you and what makes fun. Otherwise, you won't do that. And yeah, there's every day is an opportunity to do something small, even if it's only 3 minutes. Just regularity is the key. Huh? Okay. I don't, this is not too. So, take home message. Okay, thank you. So, okay, so at home it was only 75 minutes. But if you have, I still can stay here for a couple of minutes. So if you have questions.
Oh, I have one.
Yes.
It's a side question about the oxytocin.
Yeah.
In your institute or between your colleagues' research. I know that's the question. It's funny, but what do you think about the mushrooms, ayahuasca? Did you do something research about those topics?
Oh, this is a
No,
very good question.
I never took this, but I heard about a lot of.
Oxytocin. Yes, you're true. You are right. I recently I went to a conference about psychedelic drug therapy, and it was measured that really, I think psilocybin mushroom increases the oxytocin release. So you're on the right track.
No, I don't like to.
Yeah, but it induces
to lose my
oxytocin.
conscience.
Okay, I suggest we head for lunch, but anyone who has direct questions.
Before you do, we're gonna give you some, not in a weird way.
Some oxytocin.
Well, we got you something from all the
Oh,
EPEC
yeah.
people.
Oh,
Yes.
that's cute. Thanks, guys.
It's not the only thing, by the way.
Oh.
Oh, that's really sweet. Thank you.
So that you know.
And
we love you.
you're on hand luggage, so you have to drink it all before you go.
It's okay, we'll help. Oh, that's very sweet. Thanks, guys.